tonight with the rise in coronavirus across the country, and specifically here in Wisconsin. Charles Benson had the chance to go one-on-one with the chief medical advisor to President Biden, Dr. Anthony Fauci. Charles.
Well, one issue I brought up with Dr. Fauci is keeping kids safe in school. Milwaukee County says 1 out of 5 new cases involves children. As schools reopen, Dr. Fauci, is a surge among kids going to be an unavoidable reality, or can it be prevented?
You know, it can be prevented. And the one thing there are a couple of things you do. You surround the children with people who are eligible to be vaccinated and who are in fact vaccinated. I'm talking about teachers. I'm talking about personnel who come into contact with the children in the school system. We've got to make sure they are vaccinated to provide that veil of protection.
There are a lot of timely issues I want to address, and let's start with President Biden recommending the COVID booster shots. Why now? What changed for those who thought they were fully vaccinated?
Well, what changed is that if you look at the durability of the protection in the context of this highly transmissible Delta variant, we were starting to see literally only recently, I mean, that gets to your point of why now, that there is an attenuation of the protection against infection and mildly to moderately severe disease. What has held true and strong is the protection against severe disease leading to hospitalizations and deaths. So what we want to make sure we do is that we're not chasing after something that might inevitably happen, and we want to stay ahead of the virus.
Dr. Fauci, we are still seeing hesitancy and equity issues as roadblocks for African Americans. Less than 38% are fully vaccinated in Wisconsin. One local pastor telling us trust is still a big issue. Are more national resources needed to decrease barriers and increase confidence in the vaccine?
There are a lot of national resources going into that. We have a very strong equity program that has an equity task force that reaches out into the community to try and get people, any people, but particularly brown and black people who might have concern, and in some respects understandable concern, to get trusted messengers that can reach out to them and get the proper information to them. Because a lot of the hesitancy is really based on some misinformation or disinformation. But you want trusted people. They could be clergy members, they could be family physicians.